when we're in pain, our ability to reason and our ability to think deeply is compromised. And so on our best day when we're not in pain, chronic pain is really complex. On our worst day when we're in pain and our reasoning faculties are diminished by 70% or 60%, our chances of successfully navigating that without a leader or an expert or somebody to help pull these pieces apart, chances of success are not real high. So I think it's really important to have leadership and community. Welcome to the Joint Pain Podcast, where we have discussions on the science and art of fixing chronic muscle and joint pain. I'm your host, Matthew Lister, the founder of Align Pain Management. Today, I'm talking with my beautiful wife, Jaylee Lister. She was trained in movement studies, biomechanics, and motor behavior at Chico State University and Massey University in New Zealand. She is the Director of Clinical Outcomes at Align Pain Management. And today we'll be talking about what people need to know in order to understand and finally fix their muscle and joint pain for good. Hi.
Hi.
Thanks for coming.
Of course.
Thanks for doing this with me.
Of course.
I want to start off by just bringing a bit of context to you and your heart for people in pain. Why do you do this work?
Well, when I was in college and studying in university, I wanted a career that combined exercise science and movement because I loved it, and also more of a medical-based, data-driven mentality to that, and those things weren't commonly combined. You could see physical performance, but it wasn't combined with data-driven methods, and then you could see medical research, but it wasn't being combined with actually taking care of your body on a daily and weekly basis. And so I wanted to find something that combined those two things, but I didn't know what that was. And so finding Align was the biggest blessing of my life, and obviously now I get to partner with you in that and do that together. But I think I continually do it because there's so much hope in what we do, and there's so much purpose in bringing someone's life back. Pain just suffocates people to where they can't be themselves. They can't live the life they want. They can't be present with their family. They can't be successful in their purpose and their work and what they do in their life because they're suffocated or limited by pain. And so I think continually partnering with people in that, and not just fixing it once, but then helping them maintain staying strong and taking care of their bodies and maintaining their joints for the rest of their life is so important. And I get to lead people in that and be a part of that. And I think that's so special. So, yeah.
I love that. Glad we got to share that. Let's dive in. So what are the top 3 to 4 things that someone must know in order to understand their pain and fix it for good? We can sort of bat it back and forth. I know the first thing that we usually teach people is the difference between acute pain and chronic pain. Can you talk a little bit about the difference between the two, and why is it important to even consider that when you're wanting to fix your pain?
Totally. So acute pain is something that lasts for 3 months or less. So you think of a kid falling and breaking their arm, or an athlete spraining their ankle, or even an older person falling and having an acute injury because of that fall. Acute pain is really helpful. It tells you that something bad happened and that there's a problem, there's an injury that your body needs to fix. So I think in that regard, acute pain is really important to keep us alive. Chronic pain is something that lasts for longer than 3 months. It becomes not a signal that something's wrong anymore, but it can be a signal that something's still wrong, but it's not a life-threatening pain anymore. It's becoming a larger issue and a lingering issue that lasts and lasts and lasts, and that is not beneficial to the body. It's not serving a greater purpose. It starts controlling your life.
Yeah, and I think one of the big there's lots of distinguishing factors, but one of the big distinguishing factors is that the current medical system is really good at treating acute pain. You fall, you break your arm, get a cast, and you generally feel better in 4 to 6 weeks. Chronic pain, on the other hand, is not successfully treated in the current medical paradigm. And part of that is just that as a pain problem goes from acute to chronic and starts to cross that 3-month threshold, it starts to get complicated. It starts to get more complex, and it exits out of just being a biomechanical or a structural problem with your bones, tendons, ligaments, fascia. It also starts to morph into immune system and inflammatory dysregulation. The lymphatic system gets stagnant. You get inflammatory mediators pooling in those problematic joints. You get memorized pain pathways. Your thalamus gets wound up and sensitized. And then there's all these lifestyle variables that go into it. And so, one of the easiest ways to understand this is acute pain is relatively simple, but chronic pain is very, very complex, and it involves your biomechanical systems, your inflammatory systems, your lymphatic system, your central nervous system, your peripheral nervous system. It turns from one problem into 5, 7, 10, 15, 20, and it just gets really, really complicated. And our Western medical system doesn't do a great job. Statistically, it doesn't do a great job of treating these types of chronic issues. So I think it's really important to first make the distinguish between, am I trying to fix an acute problem or am I trying to fix a chronic problem?
And I think chronic problems can also create higher risk for more acute problems.
Totally.
And so when you have an acute injury that then leads to dysfunction in your biomechanics and higher body moves, that actually puts you at risk for another acute injury. And so I think chronic pain doesn't always look like being in pain constantly all of the time, 24 hours a day. It can look like spraining your ankle every year because of weakness through your lower body or instability through your lower body. It can look like having intermittent neck pain here and there. It can look like your ribs going out every 3 months, right? There's also chronic conditions. People don't think they're in chronic pain because they're not hurting all the time. But when you talk to them, it's like, oh, my hip hurts when I sit in the car for too long every single time, or my back goes out here and there. Those are chronic problems that need to be addressed. And those are the warning signs, right, of even larger chronic pain things happening in the future. If your ankle keeps rolling every year, then that's going to lead to, long-term surgeries down the road in 20, 30, 40 years if you don't do anything about it.
Yeah, I think that's a really important distinction to make. I think a lot of people really believe or have the belief that I don't have chronic pain because I don't have pain all of the time, right? But having pain every week or every couple weeks or every month and it's in the same spot, is a chronic pain condition. And so it's really important to get taken care of early.
Align pain management, stands for any type of chronic pain situation. I think sometimes people don't think they need us because they don't think that their case is bad enough to be a pain management case. But then when they look into it more or hear other people's stories, they're like, oh no, I actually need this. I'm so weak and I can't do what I want. This is going to be a chronic pain situation if I don't do anything about it.
Yeah, and I totally agree. And I think that one of the gaps in our medical system and in our culture is that when people have a joint problem, a muscle and joint problem, they'll often go to their physical therapist, who will help them sort of move that problem along. And then they'll exit out of physical therapy after 8 sessions, and then they'll go to the gym and they'll try to do gym things. Or they'll get a trainer because they want to work with a specialist who knows what they're doing. But there's such a big gap where physical therapy sort of just got you subsymptomatic, but they didn't fix the whole issue. And then you go to a gym and you start doing squats, or you're doing rows, or you're doing gym things. But there's this huge gap between physical therapy and the gym world that a lot of people just sort of fall off that cliff, and then they end up in physical therapy again, and then they exit out of physical therapy. They try to do gym stuff. It doesn't work. and then they don't do anything for their problem, and then they end up back in physical therapy, and they just repeat that cycle 5, 6, 7 times, and then it starts to feel hopeless. And that's
Well, and there's so much fear to feel like you're not going to be able to do strength-based things again. And like, we are super pro strength training and believe that people need to be strong, that they need to be able to squat and deadlift and row heavy weight. But if you're not doing that on an appropriate foundation, it's going to cause more problems. And so fixing the problems and then getting you back to strength training and getting you back to your lifestyle is like the most important thing. And we know people have to be strong to stay out of pain. But you just have to build that wisely. And I think that takes guidance from an expert. And people too often try and do it by themselves.
Yeah, I oftentimes tell people that you have to be strong to stay out of pain, but you can't build strength without first having stability, and you can't have stability without first building mobility. And so strength is at the top of the pyramid, and you can't magically get to the top of the pyramid without putting the foundation in place. And I think that's what a lot of people miss in that sort of climb to try to get strong again. They know they need to be strong. They know they're not strong enough, but they don't necessarily see the progression of first building stability, first building mobility.
Well, I don't think people can fully see where their body is actually at, which I think is why people do try and go back to the gym too soon or don't stay in physical therapy long enough, because they're like, oh, well, 10 years ago I could do XYZ. Why can't I do it now? It's like the body you're living on has had 10 years to change. I mean, your body's changing on a weekly basis. And we can't expect our bodies to perform at a level if they haven't been stimulated or trained at that level in a very long time. Your muscles and your bones need maintenance. They are not going to stay the same. Just like if you weren't going to maintain your car, if you never changed the tires or changed the brakes or got the oil changed or even put gas in it, your car is going to fall apart. There's no question about it. I think people expect their bodies to just stay together, and when they start falling apart, it's because of old age. Well, no, it's not because of your age at all. It's because you haven't been maintaining your joints. I mean, we have 70, 80-year-olds deadlifting more than their body weight in the gym because they're maintaining their joints and they're taking care of their body in the right way, and I don't think people know how to do that well. I mean, some personal trainers don't even know how to do that well.
Totally.
And so making sure you're maintaining your muscles and your joints in the appropriate way so that you can live the life that you want.
Yep. 100%. So let's go to the second thing. So the myth when people have a chronic pain problem or a pain problem is that it's one problem, right? I have a low back pain. I have a low back problem. It's even built into the words that we use to describe our pain problems. What is the reality? If the illusion is that my pain is caused by a single thing, what is the reality behind that?
Well, I first want to talk to what you said about speaking the way that it's said. I think our culture talks about pain in such a misinformed way because it's how we feel, right? So pain is the brain. Pain is the brain's interpretation of what's going on. It's not anything else. Your pain experience is in your brain. And so
not to distinguish, not from in your head. It's not made up. It's physically a neurobiological response to stimulus.
Yes,
yeah.
Which obviously can be influenced by fear and emotions and all of those feelings, which we could talk about so much. But I think just in the way that we are experiencing pain, it feels like it's just one thing. And so it feels like your body is saying you have pain in this one spot and this spot is the problem, when in reality, that's a lie. And it's really hard when you're stuck in pain to understand that because it doesn't feel that way. It feels like it's one problem. And so we talk about it like it feels like it's one problem. And then our medical system looks at it like it's one problem. And so everyone is staying in this mindset of like, it's this one problem, and my feelings and my experience are verifying that, when in reality, it's not one problem at all. It's multiple things all interacting together, but because the pain is in your brain, all those signals are going to your brain, and then your brain is telling you that you're in pain. But the reality is that it's very multifactorial and is really complex. So it can be a combination of your biomechanics, right? Your joint alignment, your muscle tissue health. It can be structural damage or degeneration that is being impacted by those insufficient biomechanics. It can be nervous system dysregulation, painkillers, anxiety, depression, right? All of those things impact our pain. And then immune system, inflammatory levels, nutrition, hydration, micronutrient imbalances, all of these things are filtering into the funnel of pain. And then what the person is experiencing is one pain response, or maybe multiple pain responses all at the same time, right? My neck hurts, my back hurts, my knee hurts. And all of those are rooted in multiple problems. And then it's just being funneled into this overwhelming experience of pain that's controlling your life.
Yeah. I'd love to break down those sort of 4 categories that you alluded to. So there's so when you're looking at a chronic pain problem, the singular feeling of being in pain has contributing problems, typically 15 to 30 different contributing problems that make up the chronic pain experience. And so those problems can fit into 4 major buckets, which you already alluded to, but I'd love to unpack each of those a little bit more. So biomechanical problems. So that's going to be mobility problems where your joints don't have enough range of motion, stability problems, which would include atrophied muscles in a joint system, overly weak muscles in a joint system, creating joint misalignments, joint impingements, creating hyper-focused areas of load, and then strength problems, insufficient load-bearing tolerance in the biomechanical structures, right? Bones, tendons, ligaments, fascia, cartilage, muscles, etc. Then we have structural problems. These are things that we find on MRIs. X-rays, CTs, they are the degenerative disc, the stenosis, the spondylolisthesis. It's the stuff you find on the MRI. And this, I think this bucket of problems is the most overemphasized when it comes to chronic pain. And I understand it. I get it. You get an MRI and you find a problem and you get a report from a doctor and it has something on it. It has a problem on it. And you're like, I have finally found it. I have found the thing causing my pain. Do you want to talk on that for just a minute?
I think finding something in an MRI brings people hope because, like you said, it feels like you found the problem. It feels like you found something fixable. And you hope that whatever surgery or suggestion that the doctor is suggesting is going to fix your pain problem. Where in reality, the things on the MRI, ask yourself the question, how did it get there in the first place? How did I end up with stenosis in my lumbar spine or my neck? How did I end up with bulging discs or degenerative disc disease, right? Those, if you're young and you have those things, and by young I mean 70 or younger, and you have those things, the rate of degeneration that is normal for the spine is going to be there, but that rate is exponentially increasing, and people who are young are having more and more degeneration. It's like, why is the degeneration or the structural damage happening so fast or happening sooner in life, right? And so why is there structural problems on your MRI in the first place? Something hasn't been maintained for the last 30, 40, 50 years that is now catching up to you, and you're just now getting the result of the MRI or the diagnosis of whatever it is when the problem has been there for much longer than just the diagnosis.
Yeah, and a lot of times that the biomechanical dysfunction where your joints aren't working properly leads to the degeneration. Mm-hmm. I think the other tricky piece with the MRI findings, the X-ray findings, is that you found something and you think it's your pain problem. because it's really easy to think that that thing is causing my pain. That thing is causing 100% of my pain. The research just doesn't bear that out, though. A lot of MRI findings, particularly in the spine, but all over the body, a lot of MRI findings just don't have strong correlations to pain. There are high percentages of people with no pain at all who have degenerative disc disease, who have tears in their discs, who have stenosis, who have these degenerative conditions that we find on MRIs, but they have no pain at all. And so that research really breaks the causal link between this MRI condition and this pain that I'm experiencing. But like you said, that finding brings people hope because they've found it. They think they've found it, and now they can figure out what the solution is for that it. And they're hoping they can move past it. And unfortunately, it's not really the case, and that can really sap the hope out of people when they finally get that realization that surgery isn't going to fix your pain, that finding isn't necessarily causing all of your pain.
Well, and even people who have surgery, sometimes it doesn't take away their pain. I mean, you were a great example of that yourself.
Yeah.
And so I think there's also can be a ton of disappointment and even more hopelessness when you feel like you found the thing on the MRI and you get the surgery to fix the structural damage and your pain is still there or it's worse. And it can just feel so defeating. Like there's no hope. There's nothing else that could work because if I got this surgery, then nothing else could help me, right? Because I chose the most extreme option for my structural damage. And so also knowing that your structural damage or the structural changes, so your MRI results, right? Those are only a certain percentage of the problem. They're not the whole picture. Regardless if surgery hasn't helped your pain or has helped your pain, there's still more to the story and there's still more that can be addressed. And for people who maybe have had surgeries that have helped, taking care of your biomechanics and your immune system and your nervous system can keep you there so that you don't end up getting another surgery in the future. Or for people whose surgery was not the answer, there's probably so much else that needs to be addressed that could bring you out of pain and will bring you out of pain when the whole problem is looked at and the whole person is looked at and everything else that is dysfunctional is fixed, because there's more than just surgery to fix a chronic pain situation.
Yeah, I think I can personally attest to losing hope when a surgery didn't work. And to be clear, we aren't anti-surgery. When there is a need to fix a structural issue, we want our clients to go and get that fixed.
Yeah, absolutely.
But so after my first discectomy, didn't fix my pain. After my second discectomy, didn't fix my pain. So I'm 2 back surgeries in, still on opiates, still in a ton of pain, still on a cane. I'm probably 7 or 8 years into a really severe chronic pain journey. Then I have most of my lumbar spine fused, still in pain, still on a cane, still on a ton of opiates. Average pain levels were a 7 or an 8. Couldn't live the life that I wanted, and that was 3 years post the 3rd back surgery. And so for all accounts, I have had 3 failed back surgeries. I go to my surgeon and offers me a 4th. and at this point, I know the stats, right? A failed or a 4th back surgery has a 5% chance of success. And so the likelihood that the next surgery is going to be the one that fixes you, those stats just keep getting worse and worse and worse and worse. And so you don't want to be chasing surgeries with surgeries and surgeries. It just doesn't play out well. But every time that next surgery failed, it was just this huge blow to my hope and my happiness and my prospects on life. I mean, it took everything.
Yeah.
So going back to we talked about the biomechanical bucket. We talked about the structural bucket. Now, if we go over to the inflammatory bucket of problems that contribute to people's chronic pain problems, we have any nutritional variables that are going to drive up inflammation, right? So refined sugar, processed foods, salt, dairy and gluten for some. These are all going to be things that drive up levels of pain. Alcohol. Also, lack of movement needs to be put into that bucket. When you're hurting, you move less. Natural response. But the problem with that is when you move less, you don't move lymphatic fluids out of your joints. And when you don't move lymphatic fluids, you don't move those inflammatory mediators, that inflammation out of your joints, and then you end up with more pain because you're moving less. Well, when you have more pain, well, then you move less even more, and then you have more pain, and this can become a really tricky spiral. Then we go over to go ahead.
Well, I was going to say the pain and that whole spiral also just leads you to eat more of those foods, right? Emotional eating, what makes you feel good, sugar, alcohol, right? All the foods that increase inflammation. You're just going to want more of them when you're stuck in that pattern.
Yeah. Women go toward sugar, men go toward alcohol, statistically speaking. So then we go over to the nervous system problems. I think this is the most abstract of the problems for people to understand, because the problem is inside their brain and their nervous system, but they are inside their brain and their nervous system, so it can be really tricky. You can't look out at it, right? And so as you cross that 3-month threshold, you begin to get memorized pain patterns where your thalamus, your spinal cord, your peripheral nervous system begins to memorize these pain patterns. They begin to turn on more nociceptors, more nerves, and even when the original problem goes away, that memorized pain pattern is left behind, and then you have pain even though the original problem is no longer there, and that can be a really difficult thing for people to navigate. And anything that dysregulates your nervous system is going to be a problem, a pain problem. It can drive up pain levels. Do you want to speak to some of those?
Opiates.
Opiates are a big one.
Number one being there.
Yep.
I mean, anti-inflammatories can be super helpful for a duration of time, right? If inflammation and those things need to be brought down for the nervous system. But any medication that your nervous system is becoming dependent on is going to dysregulate it even more.
Yeah. Yep. Stress, anxiety, fear, not having enough human connection, so loneliness,
grief, trauma,
PTSD. The stats between the correlation between people who have PTSD and then who have chronic pain are extraordinarily high.
And that's not to say that the chronic pain is only because of the PTSD, right? And so I think that I just don't want it being perceived that, I have depression, so I'm in chronic pain. It's because of your depression. You just need to fix your depression. No, again, it's just like the structural damage. It's a piece of the puzzle.
Yeah.
Yes, it needs to be addressed. Is it the sole problem? Probably not.
Yep.
And so I just think it's really important to know, again, it's not just one of these things causing your pain. It's multiple of them. And I think my biggest suggestion for people in chronic pain is find an expert to help you. Find someone to help you lead you through your journey. Because when you're in pain, it is all consuming. Like you said, you're inside of it. You're inside of your brain. You're inside of your nervous system. You're inside of your joints. And it's so hard to try and fix it by yourself, to pull yourself out of that, trying to see and analyze what your body is doing while you're also experiencing at the same time. And it feels so lonely. It's so isolating and so lonely. And again, that's going to drive more fear, more hopelessness, more eating inflammatory foods, less movement, which then impacts your biomechanics. And so when you get help and you have hope and you have community to do that with, and you have somebody to trust and lead you through that, I think that's absolutely irreplaceable. And we know the exercises to do and we know the lifestyle habits we need, but having community to be around you and walking with a leader to lead you, but also walking with other clients who are in pain, who are in the same journeys, and you get to see, wow, this person was here and now I see him doing this. Like, it's so beautiful to be surrounded by other people, and like, don't do it alone if you don't have to, because it's almost impossible to do it alone. Like, you need community.
Yeah. And I think leadership is the other part of that that's really important too. It's so, like you said, it's so difficult to navigate these problems because you're inside of them. Mm-hmm. And I think it's so valuable to have someone who can look at the problem from the outside and sort of start to pick these variables apart and start to lay all the problems out on the table and go, okay, we've got 15, 20 problems here. This looks like a mess. It's okay. Mm-hmm. We got this.
It feels overwhelming when you're like, oh my gosh, there's 30 different things I have to fix. How am I going to fix all of this?
Yeah. And so to have someone go, don't worry, we got this. We'll have all this knocked out in 4 to 6 months. You're like, oh, great. Mm-hmm. And the other part of that is that when we're in pain, our ability to reason and our ability to think deeply is compromised. And so on our best day when we're not in pain, chronic pain is really complex. Mm-hmm. On our worst day when we're in pain and our reasoning faculties are diminished by 70% or 60%, our chances of successfully navigating that without a leader or an expert or somebody to help pull these pieces apart, the chances of success are not real high. Mm-hmm. So I think it's really important to have leadership and community.
Yeah, and I think just this week I had a couple clients who had little setbacks in their pain and traveled, and now they're hurting a little bit more. And like the amount of like disappointment and discouragement was like way higher than it needed to be. I'm like, whoa, we're good. Like, we just needed to do XYZ. You're going to be feeling good by the end of the week. We're good. We're fine. We got this. And I think just me being there to tell them, hey, actually, no, we're going to be okay, brings like so much relief to them. And they're like, oh, I trust you. I'm good. Yeah. And then a couple days later, I get a text message and it's like, you were right. I feel so much better. Thank you so much for encouraging me. Yeah. And so when it's hard to speak truth to yourself, you need someone there to speak truth to you in the midst of it.
Yeah, I think that's really powerful. Okay, let's move to the third thing that we often tell people, that I think the illusion is that they've tried so many different things and that nothing is fixing their pain. They're trying to fix their pain. They're sort of chasing their pain. What we teach people is that pain is the fire alarm, not the fire. Do you want to talk on that for a bit?
Yeah, like we said before, pain is in your brain, right? So that pain signal is the fire alarm telling your body, hey, something is really wrong, whether that's acute or chronic, right? That pain signal is saying something is not right. We need to fix something here. But the root cause or the pain generator, which is the fire, right, is not always where the pain signal is coming from. It can be above or below the joint. It can be a nervous system problem. It can be an immune system problem. And so our medical system and our culture is so symptom oriented, right? And I think culturally we really love pleasure or things that bring us joy or happiness. And I think the medical system is kind of the same way, right? It's like, let's make you feel good. Let's take away this pain. How are we going to take away the pain? And they focus on the symptom, right? to some extremes of even burning nerves so that the nerves stop sending the brain pain signals. It's not the nerve's fault it's in pain. Like, don't take it out on the nerve. The nerve is there to tell you that something is wrong. So burning a nerve is just turning off the alarm, but it's not actually putting out the fire. And what do you think is going to happen? That fire is going to spread all around the house. The pain is going to spread all around your body, and one pain signal in one area is going to turn to multiple pain signals in multiple areas, and then you're just silencing those pain signals too, and you're not actually fixing the problem. And so I think that you have to find out why you're in pain, which we have to step back and we have to look at your whole body, specifically the whole joint system, right? So if it's your low back, we need to look at the joint system that's feeding extra load and more tension in your low back to fix the pain problem. If it's your knee, we have to look at your hip and your ankle. We can't just look at these one spots and silence that pain signal and expect everything to get better. The fire is just going to keep spreading.
Yeah. The illustration that I often use for this principle is that you are sitting in your living room, you're on your couch, and a fire sparks up, going up the curtains, and it starts raging up, it starts touching the ceiling. And over to your right, the fire alarm goes off, and it is deafeningly loud. And what do? Do you run and get a pillow and try to make the fire alarm slightly less loud? Do you sit there and plug your ears, hoping that it goes away? Do you run and try to take the batteries out of the fire alarm? No, that's patently absurd, right? You would run and you would deal with the fire. And in this particular situation, like you alluded to, the fire is the biomechanical problems, the structural problems, the inflammatory problems, the nervous system problems. The fire alarm is just your body telling you that there are problems. And so if you just focus on silencing that fire alarm, decreasing your pain signals, you never actually deal with the fire, and then the fire burns the house down. Mm-hmm. And that's what we see when people have ignored their problem for 10 years, 15 years, 20 years, is it started as a small problem. It started with a little bit of knee pain, it started with a little bit of low back pain, and then all of a sudden it went low back pain, hip pain, low back pain, hip pain, knee pain, plantar fasciitis. Now you have memorized pain pathways, lymphatic system issues, all these lifestyle variables. You're not sleeping good, and these problems just compound on top of each other.
Mm-hmm. Well, I think with the illustration, if there's a small fire on the stove in your kitchen, you'd be putting out that small fire real quick so it didn't spread into the rest of the house. It's the same with the body. If you have a little bit of IT band pain in the lateral side of your knee, you need to get that fixed. Otherwise, it's going to turn into a whole kitchen fire, and then in 15 years, you're going to need a knee replacement. Yep. And so I think not ignoring the early warning signs. If you have constant tightness and discomfort in your neck, if you have minimal pain here and there, right? Those are early warning signs. Those are small fires that are gradually going to turn into larger fires. But I also think the hope of it is if there is a giant fire that's burning the house down, you still can put it out and you can still rebuild that house, and you do not have to be living in that giant fire. And I think there is, even if you feel like your chronic pain situation is so hopeless, it's all consuming, it feels too big to fix, it's not too big to fix. Yes, it's going to take a little bit longer, and yes, it's going to need consistency, but when you have the right guide and you know what problems to fix, you can put any fire out.
Yep. Message of hope.
Yeah.
I love it. I love it. Okay. Let's go to the fourth thing. The myth is, I have tried everything. My doctor or physical therapist said there's nothing that can be done for me, that I need to just live with the pain. How many people have come to us and, and told us
so
that?
many. And it absolutely breaks my heart, because it's happened to people so close to me that get told they'll never be able to pick up their kids again.
Yeah, and I think that there's nothing more hopeless than losing the things that are your identity and the things that you love doing, and learning that you will never be able to do those things again it's defeating, and it's absolutely horrible. I I know I've walked through that. I know we've had plenty of people around us, given our line of work, who who have been told that. So what is the reality of that situation?
I think the reality is they're just not looking at the whole problem. Like, there's something else there. And I think what's infuriating is sometimes it's so simple. And I'm like, how did a physical therapist not see this?
Yeah.
How did a surgeon not see this? Like, this is a minor thing that if the person could fix this one thing, it would solve 80% of their problem.
Yeah.
And so I think it just breaks my heart that people are told they'll never be able to live their life again. It's wrong. It's just false. It's just a lie. And so if people are in that situation, like, have someone else look at your body, get a second opinion, get a third opinion, get a fourth opinion, get somebody else until you find somebody who's going to fix your pain generators. And I just think of one of my clients. She was in pain for 20 plus years. She went to almost every teaching hospital in America, had multiple failed surgeries, and she's now pretty much pain-free, or her pain levels are very manageable to where she can go kayaking and drive her car and go on walks with her dog, things that she wasn't able to do when she was bedridden because she was in so much pain. And so there's like we said, it's multifactorial. There's other things that need to be fixed. And if you're not able to live your life, or someone's telling you this is just the way it's going to be, there's something else there. There's something that's getting missed.
Well, I think that I wish that the people giving that advice, that there's nothing else that you can do, would flip that, and they would say, there's nothing else that I can do. You have reached the limit of my understanding. Mm-hmm. Because that would push the patient on to people with a higher level of understanding, or a mm-hmm. different level of understanding, right? And so if a medical practitioner says there's nothing that you can do and you are going to be in pain for the rest of your life, all they are saying is there's nothing that I can do. You have reached the level of my understanding. Mm-hmm. And from where that medical practitioner is sitting, I don't see your path forward. That's what they are trying to say. They are just not saying it very well.
Yeah, I think the illustration of every practitioner, right? So whether it's a spine surgeon or a chiropractor or a physical therapist or a massage therapist, they're looking through the keyhole of what they're taught, right? And so if they can't fix it with what they're taught, then they're going to be like, oh, sorry, there's nothing we can do. Well, it's not, like you said, it's nothing that they can do with their key of expertise. Go find a different key, right? Or take a step back, stop looking through the keyhole and look at the entire door. Maybe that door isn't locked at all and you've just been sitting and looking through the keyhole when there's no hinges on it and you can just push it over, and somebody sees that maybe wouldn't have seen that if they weren't looking through the keyhole of their expertise. And I do think there's a time and place for those people, right? Totally. There is a time where you need chiropractics. There is a time where you need physical therapy. There is a time where you need a surgery. But when you're stuck in a chronic pain situation and those things aren't helping, then it's time to find something else.
Yeah. And there's always something that can be done, right? If you have this incontractable structural issue, well, then you can work on biomechanics, you can work on the inflammation, you can work on the nervous system. And so if there's one piece that there's absolutely nothing that can be done for it, which I think is almost never the case, there are still dozens and dozens and dozens of other structures and systems that can be optimized in order to decrease the amount of pain you're in. So the principle with that is what we call the North Star principle. And basically it is in order to have healthy, pain-free joints, you must be adequately mobile, adequately stable, adequately strong, with a healthy and regulated immune and nervous system. So lots of and statements, not or statements. Mm-hmm. And so we have to be mobile, stable, strong, and have a healthy and regulated immune and nervous system. It's not one or the other. It's not, oh, do lots of yoga, get really mobile, but ignore your stability and your strength. It's not go lift weights and ignore your mobility and your stability and then eat refined sugars. It's all of those things. And so when we say adequately mobile, we aren't talking in vague terms. We're talking in highly specific terms. Your big toe needs to be able to extend backwards 60 to 90 degrees. Your ankle needs to flex 45 to 60 degrees. Your hip needs to be able to extend 15 degrees. Highly specific metrics that we can test for, that can be tested for. And then if there's a problem, can be fixed. And then we just have to find and fix problems, right? And so on the stability side, again, highly specific metrics that your body will give us if there are atrophied muscles in a joint system. You're going to get joint misalignments. Your shoulder blades should sit 0 to 10 degrees anterior, not 45 degrees anterior. Your pelvis shouldn't be rotated or have a big anterior tilt. Your ankles shouldn't be collapsing. Your toes shouldn't be adducted in or squished in, if you like that word more. These are all signs of stability losses. Adequate strength. Well, strength is sort of an imprecise word that doesn't really mean a whole lot. A better word for strength that I like to use is load-bearing capacity. When you're building a building or a bridge, the engineer will look at it, they'll design the shape, they'll design the weight, and they'll calculate to a very small area how much load and stress is going to be on each and every segment of that bridge, let's say. Well, then they pick a material that will have an adequate load-bearing capacity for the load that's going to be placed on it, and hopefully with a margin of error on top of that. We have to do the same things for our body. We have to look at our body weight, the length of our femurs, our geometry. Then we have to look at the lifestyle we're going to live, and we have to do the math on how much load are we actually placing through each and every segment of our joints. And then we need to do the math on, well, if we apply a margin of safety above that, that is how much load-bearing capacity we need in that joint system, so that way that joint system doesn't break down over time. I think that's a really difficult one that people carry a lot of misbeliefs around. On the healthy and regulated immune and nervous system side, we have to have a healthy inflammatory response that doesn't have a lot of chronic inflammation in it. As chronic inflammation rises, we're going to have pain, so we need to have low levels of chronic inflammation. On the nervous system side, a healthy and regulated nervous system is a nervous system that doesn't have memorized pain pathways, that isn't stressed or anxious, that has plenty of human connection, that isn't highly sensitized. And so that North Star principle, adequately mobile, stable, strong, healthy and regulated immune and nervous system, that is the North Star that we, as you well know, navigate our clients toward when they have these really complex chronic pain cases and they have 15, 20, 30, 40 problems going on this map. And we go, okay, this looks really messy, looks really complicated. Let's just take a step back. What are we going to fix first? Let's just take it piece by piece. Let's work on the mobility problems first. Let's work on the inflammation in the nervous system. Let's calm those things down. Once we have adequate joint mobility, we've reduced inflammation, we've reduced nervous system sensitization, then we can start firing and getting those atrophied muscles working again. Then once we have adequate mobility, adequate stability, healthy and regulated immune and nervous system, now we have a good platform for building strength. But if you do it out of that order, you're almost certain to fail.
And I think this process takes time, right? So we always tell our clients, think in terms of weeks and months, not days. We cannot base what we do based on symptoms. And if your treatment plan is based on symptoms, then it's probably not a very good treatment plan. And we have to get mobile, stable, and strong regardless of pain levels. We have to have a healthy and regulated nervous system and immune system regardless of pain levels. And so on the hard days, we're focused on the same thing. On the easy days, we're focused on the same things because all of those things are getting us to a pain-free life. I also think that when you have a diagnosis like rheumatoid arthritis, right, that's like an autoimmune of inflammation and pain in the joints, it can feel really discouraging of like, oh, well, I'm never going to be out of pain again, or there's nothing I can do for my body. When in reality, you can fix still 95% of the pain problem. And maybe there's some things that are going to take a much longer, more robust thing to address, like rheumatoid arthritis. But you can also have a lot of initiative and things that you can be doing now to make that situation better. And so there's not even hopelessness in some diagnosis, because there's multiple things you can be working on and fixing regardless of your situation.
Yeah, I think that that's a really powerful idea that people can take home, in that if there is one piece of the big pain problem that isn't fixable, there are still 17, 20, 30 other problems that can be fixed that can decrease your pain. And so can you get 100% pain-free? Well, I don't know, but if you fix the 27 other problems, even though you can't fix the 28th, you might be able to get your pain down by 90%. Is 90% pain reduction good?
You can live your life at a 90% pain reduction.
I'm going to go with yes.
Yeah.
As someone who's been in pain, I'm going to say yes, I would take a 90% reduction.
Yeah. If it is enough to let you live your life and let you live your purpose, it's worth it.
Yep. Wonderful. Great. Thanks for sitting down and talking with me.
Of course. Thanks for having me here.
Hey guys, thanks for watching the first episode of the Joint Pain Podcast. If you want more information, you can go to our website, experiencealign.com.